The issue of diabetic retinopathy is a very serious in Europe, because the number of people with diabetes are increasing, which is another risk for the long-term complications of diabetes, and the population is aging too. So, as the duration of diabetes, one of the non-modifiable risk factors for the development of diabetic retinopathy. With this aging population, I think in the future we will have a bigger challenge if the trend continues like this. I think many, because at the end, when we speak about diabetic retinopathy, this is an end organ response to a systemic disease. So you cannot treat or try to slow down the progression of diabetic retinopathy but by just focusing on the eye. Systemic control of blood glucose, control of the hypertension is very important too. This is not an acute disease, this is a chronic disease, this is a lifelong disease. So therefore you should have a lifelong approach, and this in a coordinated way. Teamwork is very important, and most importantly, having the patient at the very center is very important, because the patient should also actively take part in his or her diabetes care. This is the only way to reduce the burden of these chronic conditions in the older population.